Silent fields, the hidden link between pesticide mixtures and rising childhood cancers in agricultural communities. Introduction. Childhood cancer is one of the most alarming and emotionally charged health crises any family can face. While advances in treatment have brought hope, the search for preventable causes remains critical, especially in rural communities surrounded by agricultural activity. A recent study from the University of Nebraska Medical Center has revealed a disturbing association between increased exposure to pesticide mixtures and higher rates of childhood cancer in the state of Nebraska, one of the most agriculturally intensive regions in the United States. The research found that even a 10% increase in exposure to pesticide mixtures was associated with a 36% increase in brain and central nervous system cancers, a 23% rise in leukemia, and a 30% increase in overall pediatric cancer rates among children and adolescents. Unlike previous research that examined individual chemicals, this study assessed the effects of cumulative pesticide exposure over 2 decades, offering a more realistic understanding of how families in farming areas experience chemical exposure. With children being particularly vulnerable to environmental toxins, the findings underscore the urgent need for public health interventions, stronger regulatory monitoring, and further research into the combined effects of agricultural chemicals on developing bodies. A new study from the University of Nebraska Medical Center has brought national attention to a growing public health concern: the relationship between pesticide exposure and childhood cancer rates in agriculturally intensive regions. Focusing specifically on Nebraska, a state with one of the highest pesticide application rates in the U.S., this research reveals a disturbing association. A mere 10% increase in exposure to pesticide mixtures is linked to a 36% increase in brain and central nervous system cancers, a 23% rise in leukemia, and a 30% increase in overall childhood cancer rates. The research, published in early 2025, stands out for both its scope and methodology. Using 2 decades of pediatric cancer data and environmental exposure modeling, scientists at the University of Nebraska Medical Center identified a statistically significant increase in cancer incidence linked with estimated pesticide exposure levels throughout the state. Importantly, the study did not isolate individual pesticides, but examined the cumulative impact of chemical mixtures, which more accurately represents how agricultural families and nearby residents are exposed in daily life. This approach adds to the growing body of evidence showing that synergistic effects of multiple chemicals may be more dangerous than the sum of their parts. Children are not just small adults. Their physiological and behavioral characteristics make them uniquely susceptible to environmental toxins, including pesticides. According to the World Health Organization, children have a higher surface area to body weight ratio, which leads to greater absorption of contaminants. Their organs are still developing, making them more prone to damage from toxic insults. Infants and toddlers spend more time on the ground, where pesticide residues settle. Hand-to-mouth behavior increases ingestion of contaminated dust and soil. Developing immune and detoxification systems are less capable of eliminating harmful substances. This vulnerability means that even low-level chronic exposure during critical windows of development can lead to long-term health consequences, including changes in DNA, impaired neurodevelopment, and carcinogenic effects that may not manifest until years later. Until recently, much of environmental toxicology has focused on individual chemicals in isolation. Regulatory limits and health advisories are generally based on a safe level for each chemical. However, this model fails to reflect reality, especially in agricultural zones where people are exposed to multiple pesticides simultaneously through air, water, soil, and food. Emerging science suggests that chemical mixtures can interact synergistically, amplifying toxic effects even when each chemical alone is below its safety threshold. This concept, known as the cocktail effect, is gaining attention in environmental health circles and has profound implications. Endocrine disruption may occur at lower doses when multiple hormone-mimicking chemicals are present together, Immune suppression, oxidative stress, and mitochondrial dysfunction can be exacerbated when chemical exposures are layered. Cumulative exposure over time, particularly in early life, may create lasting epigenetic changes that predispose individuals to disease. The Nebraska study is one of the first large-scale efforts in the U.S. to apply this understanding to real-world data on pediatric cancer, making its findings not only urgent but also deeply relevant for other agricultural states and regions worldwide. The findings call into question whether current safety regulations for pesticide use adequately protect children, especially those living in close proximity to farmland. Several implications emerge. Current exposure models may underestimate risk. Regulatory frameworks based on adult male physiology, single chemical thresholds, and occupational exposure standards fail to capture real-life exposure scenarios for children in agricultural communities. Monitoring is inadequate. Most states, including Nebraska, do not routinely monitor for pesticide residues in homes, schools, or children's bodies. There are no federal requirements for testing chemical mixtures in air or water near farmland. Disparities in rural health persist. Many of the children affected come from farming families or low-income rural communities with limited access to pediatric oncologists or environmental health specialists. Delayed onset and intergenerational effects remain poorly understood. Long-term exposure to pesticides may not show up in early childhood but can contribute to disease in adolescence, adulthood, or future generations through epigenetic changes. To respond effectively, the study's authors urge a nationwide reevaluation of pesticide safety regulations. This includes longitudinal studies monitoring children in high-risk regions, biomonitoring programs to detect pesticide metabolites in urine, blood, and breast milk, and the establishment of exposure databases that track combined chemical loads, not just individual toxins. While many exposure sources are systemic, there are steps families can take to reduce risk and advocate for change. Washing produce thoroughly, even organic, helps remove residues. Limiting outdoor activity on days when nearby fields are sprayed, especially for young children, may help reduce direct exposure. Using HEPA filters indoors and removing shoes before entering the home can limit indoor contamination. Encouraging local schools and policymakers to support environmental monitoring and protective regulations is key. Families may also choose to get involved in community science projects, which may offer access to water and air testing resources. Conclusion: the detection of a clear correlation between pesticide mixtures and rising childhood cancer rates in Nebraska serves as a powerful reminder that chemical exposures in early life matter. Children's developing bodies, their behaviors, and their close proximity to ground-level environments place them at a heightened risk for long-term harm. This study reinforces the need to consider not only single chemical safety thresholds, but the full spectrum of chemical interactions that occur in the environments where children live, play, and grow. As we learn more about the health consequences of environmental pesticide exposure, it is imperative that policymakers, healthcare providers, and communities take decisive action. From biomonitoring programs to updated agricultural regulations, a science-based and preventive approach can protect vulnerable populations and reduce future cancer burden. The soil that feeds us should not be the same soil that silently endangers our children.